Hello, and welcome to a virtual tour of the Center for Simulation Education located at the beautiful Health Innovation Center at Northern Kentucky University. The Simulation Center is located on the third and fourth floor in the Health Innovation Center. The third floor includes the Outpatient Simulation Center, and the fourth floor includes the Inpatient Simulation Center. We're going to start our tour on the third floor at the Outpatient Simulation Center. Our first stop is at a patient exam room. We have 8 patient exam rooms on the third floor. These patient exam rooms are utilized by students from multiple different health profession programs. Students use these rooms to conduct patient assessments on each other or on standardized patients that are usually played by actors. Here we can see a student conducting a physical exam and a standardized patient played by an actor in one of the patient exam rooms. Our next stop is a living space, also located on the third floor. This area looks and acts like an apartment with a full functioning bathroom, shower, and kitchen. Students from different programs like social work and nursing can use this space to visit clients and patients at home. Here you can see a student conducting a home visit with a client in the apartment. Next on our tour, we're going to visit the Inpatient Simulation Center located on the fourth floor. Our first stop is in our operating room. As you can see, this is a full functioning operating room with real equipment that is primarily used by nurse anesthesia students. Here you can see students in action conducting a video guided procedure that is broadcasted on the large screen in the room. Our next stop is in one of our 7 patient rooms located on the fourth floor. Students from all different programs and levels utilize these rooms to participate in simulation programs that allow them to interact with patients in real time. In this picture, we can see a high-fidelity simulation mannequin laying in the bed. This mannequin is called a SimMan3G. These mannequins can provide a lot of different reactions and assessment tools for our students. This mannequin can blink, can breathe, can talk. Students can assess breath sounds, pulses, and many other features that the mannequin can offer. Here you can also see that the patient is attached to a patient monitor and a working IV pump with fluids. There's also a radiology image displaying on the screen above. Here we can see 2 students interacting with our simulated patient. One student is taking a blood pressure on the mannequin, where the other student is asking the patient questions and recording responses. Next is our critical care area, probably the most utilized room in the simulation center. This room can hold 4 patients, and we can conduct simulations on 4 patients simultaneously. There's also a dividing wall that can split the room in 2, so we can conduct a simulation with 2 patients at a time. This room is usually used for high-stake critical thinking and critical patients. Nursing students and other students from different disciplines will work in teams to resolve, assess, and treat the patient in real time. Here you can see a group of students working together as a team to assess the patient, recognize what is wrong with him, and treat him according to their findings. Our high-fidelity mannequins can not only provide assessment tools to our students and communicate with them, they can also provide feedback on critical care skills. In this example, we could see a student conducting CPR and chest compressions on the patient. The patient can respond to CPR attempts and view feedback on the screen as well. So how does this all work? Well, this is the next stop on our tour. This is one of our many control rooms. This is where all the magic happens. Every simulation environment has an attached control room where a simulation technician, faculty member, and educator sit and conduct the simulation. This is where the simulation technician can facilitate the simulation by controlling the mannequin, providing any audio and video feedback to the students, and the faculty member and educator can watch the unfolding case and provide necessary feedback and communication items to the students. Aside from our adult male and female mannequins, our students can also go through experiences with obstetric, pediatric, and neonate mannequins. In this picture, we can see a student evaluating an obstetric mannequin that is 9 months pregnant. Students can evaluate different pregnancy complications, and this mannequin can even deliver a simulated baby in real time. Here you can see a neonate newborn mannequin that is assessed by a student for heart and lung sounds. Next on our tour is one of our many debriefing rooms. This is where the learning happens. Every simulation environment we've seen so far is an area to provide an experience for our students. The debriefing rooms is where a rich pre-brief and debrief discussion occurs before and after every simulation. We typically have a group of 8 to 10 students, and 2 or 3 of them are actually participating in the simulation. The rest of the students will view the simulation as it unfolds on the screen in the debriefing room. Students will be pre-briefed before the simulation activity and take notes about a plan of care and treatment plans before they go in the room. After the simulation activity has ended, all the students meet together with a facilitator and educator in the debriefing room and discuss what has happened in a constructive way. This concludes our virtual tour. For more information or for any questions, please visit our website at nku.edu and type in Simulation Center in the search engine. Thank you.